Dr. Gavami, a board-certified plastic surgeon, has a membership with the American Society for Plastic Surgeons and has recently been inducted into the Rhinoplasty Society, which holds less than 70 members worldwide. Dr. Gavami is an assistant clinical professor at UCLA David Geffen School of Medicine in the Division of Plastic Surgery.
For me, really, the key to life is to be creative. If I'm not creating something on a daily basis, I don't feel truly alive. For me, plastic surgery is just an extension of all the other aspects of my life that I'm creative in. I've played guitar and composed music since I was 13. I draw, I sculpt if I ever get a chance to, and really on a daily basis, I'm sculpting patients. My media, instead of oil, acrylic, and clay, is really cartilage, muscle, skin, and bone.
Among the procedures that Dr. Gavami offers, several stand out and are recognized not only by his patients, but also his colleagues. The first is rhinoplasty, one of the most challenging procedures we offer here at Gavami Plastic Surgery.
I have certain passions, certain loves in the field of plastic surgery. One of them is rhinoplasty. I've written extensively in textbooks and articles, and I lecture very frequently throughout the country and the world on rhinoplasty. It really, to me, is one of the most challenging, most difficult procedures in plastic surgery. I specialize in very natural results, but I don't do Mickey Mouse or cookie cutter techniques where I just go in and do a little bit either. I do a fair amount of maneuvers and techniques to the nose to make it reshaped and stable, but that also causes it to look very natural.
The second procedure Dr. Gavami is best known for is the S-curve, a customized approach to what some people know as the Brazilian butt lift.
Fat transfer to the buttock is one of my most popular techniques that I do for my patients, and that really centers on liposuctioning the entire body, taking that fat, transferring it to the buttock to lift, rejuvenate, tighten, refirm it, and shape it. It's a phenomenal technique. Patients love it. It changes patients' lives. And the reason I call it an S-curve buttock lift is because I really create S-curves throughout the body.
This is the new shape of sexy. You're seeing it everywhere. J-Lo, Beyonce, Kim K. One doctor's calling it the S-curve butt, and now you can have it without implants. Dr. Ashkan Gavami's breakthrough procedure essentially reshapes your whole body by relocating fat from problem areas, especially the small of your back. That's the sexy part, and that's the shape that'll remind you of Selma and Sophia.
I've been fortunate that I've been doing this for a long time, and while a lot of surgeons are just starting to see the value of this and learning these techniques, it really is the hottest topic in plastic surgery right now.
The third procedure is the highly coveted flash recovery breast augmentation.
I focus on a technique which I call flash recovery breast augmentation. Others call it 24-hour recovery, rapid recovery, quick recovery. No matter what you call it, what matters is that you can deliver those results. The surgical time for me, with almost no bleeding for a breast augmentation, from the time that I make the incision to the time that I'm ready to close that incision, is around 13 to 17 minutes. And it's essentially bloodless, the ribs are not bruised, there's no injury to the tissues like there is in a traditional breast augmentation, which involves a lot of pushing, shredding, and ripping up of tissue to get under that muscle.
And joining us in studio is Dr. Gavami, my colleague. Welcome. And what you have come up with is what you call your flash recovery breast augmentation. Tell us about that.
Well, the term flash is really kind of a tongue-in-cheek term that one of my patients came up with. But really the gist of this, it's a recovery system that's quick and rapid in essentially less than 24 hours.
You have now changed it. You're doing your entire surgery with these two instruments, correct?
Exactly, yes. I had the good fortune to train under Dr. Tebbets, so I know these techniques intimately. And I deliver those for all my patients that are candidates. And I'd say about 80% of patients are able to recover in less than 24 hours based on this technique. This is something that I think is a huge advance in breast augmentation. Very few surgeons in America provide it and truly can deliver it, and I'm very honored to be one of those.
The fourth procedure is face and neck lift.
So facial rejuvenation is really a catchphrase that talks about anything you do with the face that takes back the clock. You're making someone look fresher and younger. You do not want to make them look different or weird. And every surgeon has their own style. Just as anything in plastic surgery, there's an artistic take on how every surgeon does this. My philosophy with facial rejuvenation, especially with facelifts, whenever I can, whenever it's possible, I try to go as deep as I can underneath a lot of the muscle and network of fibers of the face and take my time and rejuvenate it, and I feel like the results are more long-lasting. They look more natural because you're not relying on the skin to do your pulling. You can see her neck contour here, you can see the angle, and the distance from here to here tells you where the jawline comes to, because this is essentially her muscle, her thyroid, her cartilage, and this is how the jawline comes up. This is the bone jawline of the mandible bone. This is the nasolabial fold, which starts from the corner of the nose to the corner of the mouth. Here is her cheek contour and her cheek highlights, which I added fat transfer to. So the workhorse, the main thing that's causing the rejuvenation is the deeper tissue. We redrape it back to where it probably was when it was youthful, and then you inflate it essentially. You restore the volume by adding fat transfer and relocating fat. Removal of fat is rarely done unless it's a really, really full, square-looking face.
Dr. Ghavami is a chosen media consultant for a wide variety of publications and media outlets. In addition, he has been fortunate to continually receive invitations to serve as faculty for numerous plastic surgery conferences. Ghavami Plastic Surgery. Call today, 310-275-1959.